Good afternoon. My name is Marcela Tabima. I work at the University of Wisconsin-Madison in association with the Morgan's Institute for Research. We're looking to create a small diameter vascular graft. And the thing that I'm going to present today is how we're assessing the coverage of endothelial cells in these grafts and like the way that we are simulating the physiological conditions. First of all, I'm going to start with a little overview of why we are doing this. And like, as many of you know, cardiovascular diseases are the leading cause of death worldwide. And here in the United States, every 30 seconds, someone dies because of cardiovascular diseases. And like, it's not getting better. It's like the prediction is like in 2030, it's going to rise to 23.3 million people around the world. And in general, the patient that has cardiovascular diseases are going to need require vascular constructs, like can be a bypass or a replacement of the vessel. And at this moment, the grafts, the artery grafts and the venous grafts are the gold standard. We can use some synthetic material that they have really impressive long-term success if we talk about larger diameter vessels. But when we go to a small diameter, that is the one that we want to talk, it starts to be really tricky. And like it's estimated that up to 90% of the synthetic coronary bypass graft fails within 1 to 3 years. Here is an example of what happened with the patency. So as like you can see here, in the first 3 years, we're going to have a complete decrease of the patency. It has been shown that one of the reasons because this happened is the lack of an endothelial layer. So what do we need to do in order to be sure that we have this endothelial? The first thing is that we need to be sure that we have an optimal cell attachment. And like second, that the cells are spread in our vascular grafts. And the third thing that is really important here is like the cells have the ability to resist physiological shear stress when they are exposed to blood flow. It has been different strategies to be sure that we have a nice endothelium cell. And like one is like engineer our cells. That is part of the thing that the team is doing, is looking for different sources of cells to be sure that we have the right ones. And like, I'm not going to be talking about that. I'm going to be talking about the second strategy. The second strategy consists in be sure that we have treating the surface of our materials, that be sure that is good for the cells. Like the material that in general has been used is EPTFE and Dacron, and the one that I'm going to be talking today is EPTFE. So in clinical studies, heparin has been used, and like they have been followed up for like at least 10 years, and like they have really good results, and like they have a similar result to the gold standard that are the veins. The other material that we can be thinking is fibrin glue. There has been more than 15 years of clinical use. They have been a couple of follow-ups, like 3, 4, 7 years. And like they have a really nice results when we talk about 7 millimeter diameter. But in general, they have like the similar performance that the venous grafts. And finally, I want to present to you this dopamine, that is this little molecule that has a very good adherence to hydrophobic surface. And like the process that we can use is this process called like oxidative polymerization, in which like I am showing here in the plot, like we have dopamine and we open the rings and like we start to have oxidation. With this process, we're able to create like the thing that we call like a deep coating, in which we put our EPTFE and coat it with the dopamine. And like the thing that we're going to have is an aggregate of a small layer that is going to have 3 important conditions. The first one is going to be stable, is going to be durable, and is going to allow us to functionalize our EPTFE. And that's the thing that we are looking. So what are we going to be doing today? I'm going to show you what is the thing that our purpose of this study was investigate whether the treatment of the EPTFE grafts with protein substrates such as fibrin glue or vitronectin or the small molecules like dopamine can improve 2 things. First, cell adherence, and second, retention after exposure to flow. In order to do this, we follow this protocol that is 14 days. And like the first thing is that we use the best cells that we have that are arterial endothelial cells from IPS. like from resource, because the study that I'm going to show you is in resource. And like we do the treatment from our grafts. The first treatment that we have been doing is dopamine plus vitronectin. The result that I'm going to show today is like 16 hours of coating with dopamine plus overnight vitronectin. And the second one is with fibrin glue. The fibrin glue for this coating is important that we have the right temperature, the right pH, and like we sure that we don't have any air bubbles. When it's the day of the coating, we see that our cells in our 10 centimeters length grafts. The diameter is 3 millimeters. And the thing that we're going to be doing is a static culture. For the static culture, and to be sure that we have like a homogeneous vascular graft, we expose our cells to rotation for 3 hours and for rotation per hour. And because an important piece of the information is about how they perform when we have pulsatility, we create this mock circulation that allow us to replicate what is the shear stress in a femoral artery from a monkey. And like the way that we recreate the shear stress is a numerical calculation assuming a rigid wall. So here is a sample of how is our circuit or our mock circulation. And finally, we fix our cells, we stain and we image. Important to know, our controls are 10 days of a static culture, and like after that, like the 2 days. Here is some of the results that I want to present to you today. So when we compare what happened with our static culture, in our static culture between our two conditions, we can see that the cells are attached to our material, and like we have a good coverage that was measured through looking the amount of CD31 in our samples, and like they have a coverage that was around 90 or 100%. When we went to our dynamic condition, we realized that the cells start to detach and like start to be really patchy. So for that reason, we took a step back to look at closer to the cell material interactions. And we realized that like if we do a closer look of every day what is happening to our cells, we were able to see how they attach and to improve a little bit what happened in our vessels. So finally, what is the message that I want to leave to you? The cells, they don't like that much EPTFE by itself. The cells that are CD31 positive show the cobblestone-like morphology in static conditions, but it's a really patchy coverage when we have our grafts. So for that reason, we need to improve our endothelialization step in order to have a functional vessel. Finally, I want to say thank you to my advisor, Dr. Thompson and Dr. Chesler, and now I am open for a few questions. Thank you very much.